that. Thank you for coming. And
Thank you. Thank you so much, Dr. Limler. It's a pleasure to be here. I hope you all can hear me. I've been fighting a little bit of a cold for, a month. So I'm singing bass a little today. And yes, I am a social scientist. If any of you watch The Big Bang Theory, you know that it has been said that social sciences is hokum. I don't ascribe to that, so I appreciate you having me here and listening to a little bit of how we use communication science at the University of Kentucky to support our research translation activities. So I'm going to tell you a little bit about what we're going to do today. I'm going to give you a little background on myself, not because I'm egotistical, although I'm in academia, so what are you going to do? But because I firmly believe that when you're hearing someone speak or when you're reading something someone has written, you need to think about who are they, where are they coming from, what perspectives are they bringing to the table, and what parts of the picture are they missing. So a lot of you talking about research translation, Dave would be talking about policy, and someone else might be talking about tech transfer, and I'm going to talk about the communication side of it. Then you've talked about research translation for the last semester. My understanding is I'm here to clean up. Hopefully I won't ground out to first, and we'll bring home everything everybody has said, so you're going to see something familiar, I think. Going to talk about communication as a foundation for research translation. We'll talk a little bit about community engagement and how communication in research translation can help foster community engagement. Then we're going to wrap it up. Since this is a communication talk, I do expect you all to feed in and yell things out and heckle and throw things if you want to, but let me know what thoughts you're having as we move along. So I want to tell you how I got into research translation because I think it matters to this story. I was working at the University of Kentucky as the communication director for the Kentucky Water Resources Research Institute in the early 2000s. It's still the early 2000s to me, but around 2003, 2004, when NIHS said, you have to have this thing called a research translation corps in your Superfund centers. And Bernie Hennig, who heads up our Superfund Center at Kentucky, contacted my boss, Lyndall Ormsby at the KWRI, and asked him to head up research translation. Since I managed communication, that meant I became sort of the de facto communication director for our Superfund Center. How many folks here work with the Superfund Center or have? So you all are familiar with Superfund and how it works. So what we did was we started going to these NIHS national meetings. One of the first ones we went to was in San Diego, about 2005 maybe? Was that when San Diego hosted at La Jolla? And they put all of us who were supposed to be doing research translation in a van, in a windowless van. 2 windowless vans. And they drove us to a little boat dock out in the middle of nowhere. Some of us thought perhaps they had nefarious purposes in mind, but they didn't, because the folks from NIHS were there. We had this discussion. It's a retreat area that they have for UCSD. And we had this discussion about what do you guys mean at NIHS when you say research translation? Are you talking about translational research? Are you talking about pharmaceutical production? What are you talking about? And they said, as NIHS will often say, I think Larry will back me up on this, and Hans and David, as they often say, well, we're hoping you'll help us figure that out. We have kind of a general idea. We know it involves policy. We know it involves tech transfer. We know it involves communication and working with communities, but we're still kind of working on what the specifics are. So the next morning, I sat down with Lyndall Ormsby and said, okay, we have an opportunity here. They're figuring out what they mean by research translation, and we can help inform that, but we need the expertise to do it. So I've been thinking about taking advantage of my employee benefits and getting my PhD. I can do it in policy. I can do it in communication. Where do we think the gap is? And we look, there are folks, they're from Columbia, folks from Iowa, a lot of folks who are already really doing the policy piece. We had folks who were doing tech transfer. So we said, we think the opportunity here is in communication. So I actually was built to help inform research translation in this way, the communication piece of research translation, particularly for the environmental health sciences. That's what I built my career on. I was in my 30s when I went for my PhD. I finished it in 2013. So everything I do builds from NIHS moving into research translation and trying to figure out what they meant by that. So I'm going to talk about a few different studies. I'm not going to go into a lot of detail, but in addition to doing research translation, we are trying to build the evidence base on research translation, and specifically on communication and how it feeds into research translation. So I'm going to mention some studies, won't go into them in much detail. I'll give you some resources at the end if you want to read about them. They've been funded by NIH, through NIHS, through National Library of Medicine. Some of it's from the Department of Energy, and some of it's from US EPA. Everybody knows the mind the gap sign, right? Why would I use the mind the gap sign in a talk about research translation? I teach undergrads. I can stand here a long time. Why would I use a mind the gap sign for research translation? Experts and lay people. We have a gap of anywhere from 14 to 20 years between you having a new finding in your lab and it making its way into policy or practice or communities. That's a long time. We're getting better at it. I don't think it's 14 to 20 anymore. That's about a 3-year-old number, but it's still a long gap. So research translation is really all about minding that gap, finding a way to make sure that what we're discovering in labs, what the federal government, foundations, other funders are spending all of this money on, making sure that it affects real lives in some meaningful way and improves health. So this is a definition of research translation, a couple years old, not much, but what I want to focus on here is they're talking about the process by which knowledge is passed, right, along the translational pathway from basic science into improved community-based health outcomes, and vice versa. What does that vice versa mean? I mean, when you think about research translation, certainly you think about we're having these findings in labs, we're feeding them into communities, we're feeding them into policy. What does the vice versa mean? I'll call on you. What does the vice versa mean? Put you on the spot. I told if you don't volunteer, you will get called on. Exactly. Have you heard the phrase begin with the end in mind? That means when you start from the basic science perspective, you want to be thinking about what outcomes are you hoping to influence down the line? And the best way to figure that out is to listen to your stakeholders, to listen to your communities, listen to your legislators. What kind of evidence do they need so that you can help produce that evidence? Where are the gaps in their areas that you really need to affect? How many of you have seen this in other talks? Yeah, I'm not going to spend much time on this. This is the NIHS Translational Research Framework. Came out a couple years ago. It's very busy, right? But the main thing you need to know is we're trying to get from this basic circle in the middle where you might be doing in vivo, in vitro, population-based studies, but you're trying to get from there across all these rings to really make change, those change in outcomes, population outcomes, policies, economic outcomes. You're really trying to move that science in a way that affects those. Now, for my work, the area that I'm most interested in is this ring, let's see, the next to the last ring there. The ring that is about risk management, research practice, clinical practice, policy, individual behaviors, and public health practice. I would add there's probably a piece missing here, which is community practice, which is the collective action that can happen in communities when they are informed about environmental health risks. So this is the area that we're concerned about in our research translation core, and this is where we interface a lot with our community engagement core. But to do that, we have to exchange information. Whether you are sharing information from the lab to try to get some population studies done, or whether you are sharing information with policymakers, you have to move that information along the pathway. So what's the most common way, probably, that you would share findings from your lab? Publishing. Journal article. Now, let's go back here. Where in here are you hitting with publishing? You're obviously hitting within your concentric circle, but which of these spheres are you impacting with a publication in a top-tier journal? Risk management. A lot of your risk managers will read high-impact journals, depending. I mean, it's, a practice-facing journal is a good place to get that in. So they might be, You might want to select your journal carefully if you're going to affect risk managers. But absolutely. So where else? Who else is going to read your stuff? Maybe if you're publishing in AJPH, Journal of Public Health Management and Policy, some of those that have a very practicey kind of orientation. Yeah, health affairs, those kinds of things. So you can hit public health practitioners. Clinical practice, maybe JAMA, depends on where you're publishing. Research practice, certainly, you're going to hit your other researchers. That's the main audience you're going to hit when you're publishing. But are your
If your article is a CBPR study and you're reporting back to your community after publication of the article, then your communication is around the paper, but it's also directed towards them, accompanying
Right.
the release of the paper.
and you have to scaffold around it.
Yeah.
Right. And if it's a CBPR paper, your community has helped author it, right? So you can hit all of these audiences, but most often what you're hitting are going to be your research practice, your risk managers, and some clinical and public health practice, depending on where you're publishing. So that's one of the reasons that NIHS and others, I think, in the federal government have really pushed towards these research translation cores to have people who are in charge of making sure that you're moving all the pieces. So I want to share with you, this is an old communication model. This is, World War II we're talking, and it's very basic, but it stands up. This is how we share information. And there are a lot of other models that you will encounter if you look into health communication, risk communication, but they all start with this, which is we're sharing information, we're thinking about who is sharing what, is saying what, through what channel, to whom, and with what effect. So the who is the source. So if I'm saying it, or if Donald Trump is saying it, or if your state governor is saying it, people are going to interpret that differently. They're going to filter that differently based on who is doing the talking. Says what? That's the message. What are the key components of your message? What is it you really want to share? How do you frame that so people take away the message you're really trying to share? And if you're trying to move behavior change, whether that be advocating for a policy or eating more fruits and vegetables, right? How do you frame that message in a way that moves that needle? In which channel? What do I mean by channels? What are communication channels? What are ways of reaching information to people? Social media is a big one. It's a big one right now, for good and bad sometimes. What else? Sorry? Newspaper. So media, television, newspapers, social media, face-to-face, having a conversation, one-on-one, group discussions, community meetings. There are all kinds of channels through which we are able to share information. To whom? To what audience? I may have a finding that really should affect how individuals in a community limit their exposures, let's say. Where they go, where they don't go, to make sure that they're limiting exposures. So I want to reach them. It doesn't do me any good, necessarily, to share a message about limiting exposures with them with a different audience, because they're the people I want to take action. Policymakers, I want you to pass a law. Now that can actually affect how you communicate with your community members as well, because community advocacy for a policy can help move the policy as much as scientific information sometimes. So you got to think about who's your audience, what do you know about them, where do you reach them, and then you think about to what effect, what are you measuring, what do you want to change? Are you successful in your communication if you've changed a policy, if you've changed a risk threshold, if EPA says, okay, this many parts per billion instead of this many, right? What is your metric for change? So when you think about these things, you think about this message model, and you think about this. You can kind of see how it starts fitting together. Because if I'm trying to reach research practitioners, I'm going to think about who's giving that message. Well, they're going to respect the authority of a scientist pretty well. But if I'm trying to move individual behaviors, is a scientist going to speak their language? Is that who they're going to listen to? They're going to listen to their church leader, right? I come from a state where we just had an election, you may have heard, where a lot of the turnout, believe it or not, was driven by church leaders. And the reason it was as close as it was largely because of of church leaders. So there are trusted people in communities. Who do you tap to share the information? That's the kind of stuff we're talking about when we talk about communication. So we need to have a basis in communication as we're developing our strategies. And there are really three major fields in communication science that I'm going to talk about. There are more, but the ones I'm going to talk about today, there are three major fields that really contribute a lot to how we can devise research translation strategies. The first one is health communication. And that's really about getting people to adopt behaviors or change behaviors, or communities to take collective action in ways that protect health. So has anyone here heard of the health belief model? Can you tell us a little about the health belief model?
It's a theory that mainly influences health behavior, whether constructs are within it are valued by that individual, or threatened, or maybe not even on their radar yet.
Right. Barriers, benefits, right. So you want someone to change their behavior, you got to figure out what they think their barriers are to changing behavior. You got to think of what their benefits are. New pieces have been introduced over time, like self-efficacy and other constructs. But it's really about how do we create messages that will move the needle on people's behaviors. I'll tell you a secret. Most of the meta-analyses of the health belief model, it doesn't do much. But there are others. There are things like the extended parallel process model. There's the trans-theoretical model of behavior change, which looks at where people are on a continuum of wanting to change so that you can craft messages to move them to the next level. Maybe someone's interested in learning more about smoking interventions, but they're not ready to take that leap, so you can give them information about smoking interventions, right? So there are a lot of different behavior change models. We've got decades of research on campaigns to figure out what has worked and what has not worked. So I've got a few examples up here. We've got health campaigns about seatbelt use, right? Is there anybody in here who is not Gen X who knows this picture? Are there any millennials who recognize this as your brain on drugs? I'm going home. That was a very famous PSA campaign in the 80s when some of us in the room were in high school. That was about, this egg is your brain, and they would crack it and they'd say, this is your brain on drugs, and fry it up. And it was supposed to make it, anyway. So that's a health campaign. The truth campaign. Okay, millennials should know the truth campaign. Millennials, Gen Z, who do I have in here? Millennials, Gen Z. Do you know the truth campaign? What are they fighting for? Smoking. They're fighting smoking behaviors, right. Okay, this one should resonate with some of you guys. Lazy Town, the TV series Lazy Town. Has anybody here ever seen, any people here, not parents, who watch the kids, ever seen, okay, that's a health campaign. Did you know that about Lazy Town? Lazy Town is a health behavior campaign. There is a superhero whose name I can't remember. But he is a superhero, and he is always trying to get the kids in the town to eat healthy and exercise. And there's a villain whose name is Robbie Rotten. Now, I remember the villain's name. And Robbie Rotten is always trying to get them to eat poorly and not exercise and lay about and watch TV. That's a health campaign. And it's a health campaign that shows in many countries now. It started in Scandinavia. They've adapted it in all kinds of countries, including ours. They show it on Sprout. My daughter watched it religiously. So there are all kinds of health campaigns, and they're about audience targeting. You don't share the same message. If you're trying to get teenagers to stop taking drugs, it's a different message from when you're trying to get kids to engage in healthy behaviors. Sporticus, yes, thank you, Sporticus. Yeah, isn't that a cute pun? Sporticus versus Robbie Rotten. It's a great, high quality television, that. But kids get important messages. And you have different audiences. So you think about what messages are going to resonate with these audiences. And you think about, how do I segment them? Where do I reach them? I reach little kids with a TV show that their parents might sit them in front of so that they can cook dinner, right? So that's what health communication gives us. Risk communication is a slightly different field. Now, if you talk to a health communication expert, that person will tell you that risk communication is a subset of health communication. If you talk to a risk communication expert, that person will tell you that health communication is a subset of risk communication. So I'm not here to adjudicate that battle, but they're a little different, because risk communication is really about making sure people know what potential threats to their health and safety are. And that started out very much as a top-down kind of model, where we have the information on the pollutants at Love Canal, we will give you a fact sheet. And if you are smart, you will do what we tell you to do, and if you are not, then you will ignore it. And that puts the burden on the people to adapt to whatever they're being told to do, which may or may not be feasible within their own context. So that was sort of the start. And then in the mid-'80s, we had a little thing called the Bhopal disaster. Who in here has heard of the Bhopal disaster? Okay, who wants to talk about it? Tell us a little bit about it. Can you tell? Mm-hmm. You got the India part. That's very good. Bhopal was yeah, methyl isocyanate, exactly. Union Carbide, big corporation, had a factory in this community, Bhopal. And there was a methyl isocyanate leak. And they had disabled the warning systems and everything. Thousands of people died. And, it clings down. So it was the middle of the night. Kids were sleeping on floors. Anybody asleep on floors, they lost immediately. People are still sick. I mean, the people who survived are still sick. This was 84, I want to say. So what Bhopal did was it made people realize these people were living with risks they didn't know about and they didn't have a say in. Union Carbide was profiting, and these people were bearing all the risk. And furthermore, the clinicians, the healthcare providers in the community, didn't know about methyl isocyanate. They didn't know what the risks were. They didn't know how to treat it because they weren't informed. And they had no feed forward into any sort of precautionary measures. So what happened was people started saying, people really have a right to be engaged in discussions about the risks they're bearing. And that sort of came to a head with legislation in '86 with the Superfund Amendments and Reauthorizations Act and the EPSCRA, Community Right to Know Act. It has a much longer name, but cold medicine does not help me bring it to the fore. So the Community Right to Know Act, which basically said that you need stakeholder advisory boards and community advisory boards. You have to have people able to feed their ideas into the risk-bearing framework, right? So that's when you start getting citizens advisory boards. So at that point, risk communication becomes more dialogic. It becomes more horizontal. People are learning from each other. So we start getting best practices models of how to do that. What kinds of messages, what are the key components of messages that people need? We start talking about those kinds of things. We start recognizing that we talk about risk differently. So a scientist or a regulator, when they're talking about risk, they tend to be talking about technical hazard. They're thinking about what is the probability of something bad happening and how severe is it if it happens. So if you look at a risk matrix, that's basically what you've got, right? Probability of something bad happening, severity if it happens. That's how technical audiences tend to think about risk. Community audiences tend to think about risk in terms of, is it fair? Are marginalized people disproportionately affecting it or being affected by it? If a community is at most risk, is that community benefiting in any way from it? Or are other people outside benefiting? So you have all these things that go in to make up what Peter Sandman calls outrage. Now, Sandman and I have one difference of opinion in that he sort of says hazard is the technical audience and outrage is the community audience. And I say I've been in enough rooms with scientists and technicians who didn't think their opinion was being respected to know that outrage flows both ways. So there's outrage on both sides. There's also sort of hazard on both sides. I don't think that we necessarily always take into consideration the full context in which we're working. We're proposing solutions. So we need to be listening as well. So it becomes more dialogic, more back and forth. And by bringing more people to the table with different perspectives, we're able to make collective sense and sort of start sharing some understanding of what are the risks and what are the potential solutions. So that's risk communication. As risk communication moves on down this continuum, we start needing to think about participatory communication, which is about making sure those marginalized folks are at the table, making sure they're involved in developing messages, making sure they're involved in developing policies, and then assisting participants in developing these mutual understandings. So we move into this participatory model. Who in here has done CBPR or knows about community-based participatory research? Y'all study? I know a few of you have done it. So CBPR is really about allowing the community to take the lead in framing research questions, in working with scientists to answer those research questions. So this is really a CBPR approach to communication. And it was one of the main strategies we've used was developed for the UN Food and Agriculture Organization. And it's called Community-Based Participatory Communication. And this guy right here, Chike Onyegbunam, co-developed that particular methodology for UNFAO and was my dissertation chair, so full disclosure on that. But it's really about making sure that we're fostering collaboration in communities. So it sounds a little bit like community engagement corps, doesn't it? Sounds a little bit like the work that community engagement corps are out there doing, bringing people together through stakeholder advisory boards. So we're doing some of that. So what we did was we brought these three strands together to create the Convergent Environmental Health Communication Model for doing our research translation and community engagement work. And what you see on the outside of this ring is your basic information creation process. If I'm going to create information resources about an environmental health challenge for a community, the first thing I need to do is a needs assessment. What do people need to know? What do they already know? What do they need to know? Then I've got to prioritize those needs. Well, they probably need to know this before they know that. This is probably the most important thing I need to tell them. Then you design some messages, you test them with an audience, you adapt them, you move on and you start disseminating those messages, and then you start doing your evaluation. And that's all well and good. But where in this standard model, if you take the stakeholders out of the middle, are the stakeholders implicated? Well, you might be talking to them for your information needs assessment. You'll be testing some of your messages with some of them, ideally. And then you'll be disseminating information to them. They're not involved in the process. Whereas having many stakeholders involved in the process, creating a consultation board with representatives from policy, journalism, agricultural organizations, industry, chambers of commerce, having someone at the table from those to help advise every piece of this can help you make sure you're making really culturally appropriate decisions. Can help you make sure that you're not stepping in it. I mean, anyone who's worked in communities at some point has walked into a community and said the wrong thing to the wrong person and spent the next 6, 8, 10 months trying to come back from that and build trust. So having a group at the beginning who can help advise you in all your communication activities can really help offset some of that risk. And it can also tell you what the community needs to know, what those folks want to know, what their research questions are, and can feed into your community engagement corps as advice for activities, or as something that the community engagement corps can feed back into the admin corps for potential research studies. So there's a lot to be said for having your stakeholders at the center. Why do you need them there? Well, because environmental health risk is absolutely 100% contextual. The contaminants in Dehoyt, Kentucky, and the contaminants in Iowa City, Iowa, are probably different contaminants that we're worried about. The flooding that you guys have been dealing with here is different from the wildfires that are going on right now in California. So you got to know the context. You got to know what are the contaminants. You got to know what are the exposure pathways we're worried about. Am I going to spend a ton of resources talking to people about absorption when absorption isn't a pathway that I'm worried about with the particular contaminants? No, I've got to know what's going on. How are people being exposed to this? Are people actually eating fish from the contaminated waterway, or is that not a problem? Am I more worried about them drinking water that might be contaminated? So you got to think about all kinds of different exposure pathways, contaminants. Then you've got socioeconomic, demographic, and political factors. I work in Appalachia. We have a very unique socioeconomic, political, and demographic situation in Appalachia. We were talking this morning about, we hosted a summit with Linda Birnbaum. You know, she did her touring community summits there for a while. We did the director of NIHS. We did a summit in Appalachia, and we were told very early by our stakeholder consultation folks, don't use the word environmental in the title of the summit. Don't use it on any of the publications, because you'll get two kinds of people there. You'll get people who think you're there to take their jobs, and you'll get people who are there who are mad that their water is poisoned. And they will yell at each other, and nothing of purpose will be accomplished. So we had the Appalachian Summit on Health and Well-Being, featuring Director of NIHS, Linda Birnbaum, featuring the Director of our Community Engagement Corps, Dawn Brewer, featuring the Director of the Office of Rural Health Policy, and featuring a local clinician who ran the locally federally qualified health center. So we had the meeting, we had discussions about environmental contaminants. We didn't call it that. That's the kind of thing that having those stakeholders early and often and informing your process can really help you avoid. Because if we had walked in there and said, we're having the Appalachian Environmental Health Summit, it would have been a very different meeting. And we'd have probably had to have police there. So we were able to accomplish our ends, but thinking about framing from a local perspective really helped us do that. Then you have different people in the room who have different past experiences. I'm going to interpret a risk or a potential situation based on my past experiences or based on past experiences of the people I know. So if I've had a bad experience with, say, the Department of Energy, because I live near a contaminated site they're involved in, I'm probably not going to trust them. But if someone else is at the table who works for the Department of Energy who can convince me that, you know, they're actually working toward things and maybe there was a misunderstanding, then we can start fostering that dialogue and we can learn more about their experiences, and so that retrospective piece starts getting balanced. We can kind of change our expectations of what's going to happen. If you walk into a situation convinced that this is not going to go well, nothing's going to be accomplished, then A, you're probably not going to walk into the situation. You know, you're not going to waste your time sitting in a community meeting when you feel like nothing's going to happen. And you know, B, you're going to create the circumstances by which the interaction is going to fail, probably, because your expectations are so going to drive the way you're acting and reacting to the situation that it's going to create a tense environment from the beginning. So by bringing these stakeholders to the center, we're able to address these kinds of pieces. We're able to get a better understanding of who it is we're communicating with and what their constraints are. So who are some of those potential stakeholders? Well, if you're thinking about, say, a hazardous waste site, you've got people who live near the waste site. You've got local government officials. You've got state government officials, maybe departments for environmental protection or departments of public health. You've got, you've got local clinicians who might want to know more. You've got a lot of different folks who may have a stake depending on the contaminant, depending on the exposure pathway, depending on the other kinds of factors. So you need to think carefully about who you're bringing to that table. And you may have workers at a plant, if it's an occupational issue, who you want to have represented at the table. So you can't have everybody from every group, but if you have a voice from each of these groups, it can give you a much fuller vision of the situation. It can help you think about who does each of these groups trust. So it brings that whole, well, you know, the minister, the pastor, the priest, the church group, if they heard it from this person, it would make a difference. Says what? What messages are going to resonate? How can we frame them in a way that's culturally appropriate and we're not stepping on people's toes? In which channel? How are we going to best reach the people who live near the plant? You know, is it through the schools? Is it through their kids? Do we send home information with their children? To whom? You know, who's the most important? Who's the most important for the information? And to what effect? What are we really trying to move the needle on? So as I said, we are doing research in these areas to try to figure out what works best. So I just want to give you some examples of the kinds of research questions that we can ask. And you may wonder, why is there a big picture of tomato soup? Because when we're talking about who in communities that have long-term hazardous waste issues, we have a critical problem that sometimes we overlook. And that is that they're getting information from a lot of sources. So, you know, you're getting messages from US EPA about site cleanup. They're getting messages from ATSDR about health risks. They're getting messages, if it's a DOE site, Department of Energy site, they're getting messages about what the Department of Energy has done. If it's a Department of Defense site, they're getting messages about that. Getting messages from state folks. So they've got all of these acronyms coming at them, citizens advisory boards, all these acronyms of people coming at them, sometimes sharing the same information, sometimes sharing different messages. Sometimes even when the messages are the same message, they're framed so differently that people get very confused and they just want help. Who do I trust? Who do I listen to? What is the real takeaway? And when we have an information overload like this, it can be really challenging. And I think we see it in our political sphere when we think about social media, and everybody's bombarded with information all the time from all these different sources and what's accurate and what's not. So some of the research questions that we ask about who do people trust? Why do they trust them? How do we get people to trust certain sources more? What factors increase or decrease trust in a source? So that source question, there are lots of questions about who's the best person, who's the best spokesperson for this message. We found this finding in a lab We want to make sure that it gets into communities. Who are they going to listen to? Are they going to listen to their cooperative extension agent, their local health department director? Who's the best person? Then when we're talking about says what, that's where we start getting into those health communication models I was talking about. And you have to pick your theory and you go with it. This one is particularly a risk communication model where we took, we were given by EPA this scenario in which it was very hypothetical. There had been a contamination, intentional terrorist contamination of the water supply in Cincinnati. And the idea was everything's returned to background levels. It's been cleaned up, everything's background levels. So how do we get people to start using the water again? So what we did was we created news stories, little vignette news stories that use different pieces of the best practices for risk communication. And we had people listen to these news stories. Then we'd have focus groups where they'd talk about what more information did you need? What was missing from this? To see which best practices matter and which ones they missed. So we can ask questions about things like framing. We can ask questions about what are the key characteristics of the messages? What do we really need to get out there? We think about in which channel. You know, what works better? Is it a cooperative extension booklet? Videos on a website? You know, maps? CNN interviews? What's going to work best to get our message to the people we want to reach? Is it social media? If it's social media, is it TikTok? Or is it Twitter? I know TikTok exists. I've never used it, but I know it's there. Is it Twitter? Is it Facebook if you're trying to reach all of us old okay boomer types? Where are you trying to get? Where are you getting people? So we have several studies going on in that. Then we have the audience. That's where you get into audience segmentation. That's where you get into hazard and outrage. You want to know what are the key points that are going to drive that audience to an action. What do they need from you? How do they need it framed? And then you've got with what effect. And that's again thinking about what are we really trying to change? If we're trying to influence research practice, how? If our research translation activity is to get more research done and we see more funding coming through for this, then we've succeeded. If it's to change individual behaviors, you know, we do nutrition and physical activity as mediators, potential mediators of environmental insult at UK. So maybe our plan is they built a walking trail to get out and move more. Maybe that's something that we say, well, we had an effect that we wanted to have. Policy, obviously, that's a pretty easy one to measure, right? So you've got to think about what's your effect so that you can evaluate your activities correctly. And all of this ties into community engagement cores. It ties research translation and community engagement cores together because working with stakeholders is what community engagement cores do. We are building partnerships with stakeholders and helping partnerships form between stakeholders who might not otherwise come together, with a goal ultimately of helping to move our research findings into practice, but those same relationships can help foster our community engagement cores. We can draw from our community engagement core stakeholder advisory boards for advisors in some of these stakeholder consultation cores, depending on where we're working. I'm not going to ask one of our DAHOIT advisors to advise on Paducah, but we can reach out to the right folks, or those folks can become gatekeepers to those communities, and we can say, who in DAHOIT do you think we need to talk to about creating these messages? And we can really start building relationships, because the key to it all is trust. And there's blessed little trust in the world right now. So you got to build it, and it's one block at a time. It's not an easy process. But the research translation cores and the community engagement cores working together, hopefully we can get there. Any little bit of trust we build is a bright shining light right now. So again, you've seen this, but I want to sum up and then give you some time for questions. We need to speed research translation within those zones and across those zones. Health, risk, and participatory communication provide key strategies for this. You don't have to reinvent the wheel. You don't have to start from scratch. You wouldn't walk into a lab with a hypothesis you pulled out of the air without thinking about what's been done in this area before. What can I learn from past experiments, and how can I frame this experiment? Treat research translation the same way. Think about what can I learn from the past, and how can I apply theory, and how can I apply methodology to help me do the best job I can do. And centering stakeholders in this process can really help us build relationships. It can help us make sure we're being culturally appropriate, and it can help us move the needle. So with that, I thank you. Here are some resources on some of those studies I talked about. I'm not sure how much time I have, but I am more than happy to take questions as long as people are willing to stay and talk to me. Thank you. I was trying to leave 15 minutes. Looks like I pretty much hit that. Okay.